You're tuned into the Advo Health Podcast. We're here to talk about rare diseases, real people, and the ripple effects of change. Stories that move you, guests who challenge the norm, and vibes that keep it real.
Hello, everyone, and welcome back to the ASH Podcast, where we unpack health systems and stories that usually don't get enough attention. I'm Ali, and today I'm joined with a new, different co-host. Today, this is Renita. You guys might know her from some of the other Instagram lives or things we've done in the past. It's been a couple of years since that, but she's actually been an integral part of our club on sort of the other side of it, which has been on Instagram and doing other initiatives. Speaking of that, also, we are transitioning more just to the podcast side of it. So the club itself may not be running as frequently in terms of those initiatives, but I think this is a much better way for us to interact with audience, people who are listening, and give a better explanation of what we're trying to do and the things we want to talk about. So today we're talking about something that has been in the news recently, but honestly should have been dealt with maybe decades ago. So Renita, I'll push it off to you.
Yeah, no, for sure. Thanks, Ali. So today specifically, we'd like to focus on the evacuation of the Kashechewan First Nation after a failure in their water and sewage system, which led to contamination and confirmed cases of cryptosporidium, which is a waterborne parasite.
Just to preface before we start really talking about it, so we learned about these things through two CBC articles that came out on Jan, I think 17th and 20th. You guys can correct me on the date. Everything will be linked in the descriptions of like the videos on Spotify and Apple Podcasts, etc. But before we talk too much about it or give sort of our ideas of what's going on, we just want to preface that we are not experts in this topic. We're not, professors, PhDs, or anything or the other. Not sure if you're planning on going for a PhD, Renita, but as of right now, I am not. Not in this anyways, but we're just people sharing our opinion, having a discussion about something that is arguably affecting a important population of Canada and their health, and hopefully that sparks more people to have more of a discussion about it in the future and bring some change. Yeah.
Exactly.
Sorry, I completely lost what I was going to say. So as Renita mentioned, that we're focusing on the evacuation of the Kashechewan First Nation. So what happened was that hundreds of residents, I think actual number maybe came up to over 1,000, but I will double check on the article. But they were relocated, many to Niagara Falls, and this isn't the first time that the Kashechewan has faced a crisis like this, right?
Exactly. And even though this is a circumstance that they are facing for the first time, I remember reading in the article that these communities, they do face conflicts or problems regarding to water safety. And it was also mentioned that because they do live in a floodplain area, it's quite difficult to ensure that the water plants that are located in those areas are properly maintained, and the needful is done to ensure that water is safe for consumption and use. So even though this particular instance, I agree, it is the first time that is happening, this issue about water safety, it's something that is quite prevalent amongst communities such as the Kashechewan First Nation.
Yeah. I think while it's a very important topic, we should probably also explain what exactly has happened. So Kashechewan is a remote Cree community in northern Ontario. This is alongside the James Bay coast. And earlier this month, as Zarina mentioned a bit, that their water and sewage infrastructure failed completely, which led to raw sewage contaminated parts of the water system, making it very unsafe for the community.
Exactly. And I find that when your water system it fails, especially in communities that are remote or located in rural areas, there's no plan B, like there's no backup. And so, and in other terms, when we think about it, there's for those rural areas, there's no supply that can be taken in from municipal areas, which can serve as an alternative to help resolve these kinds of issues. But because of how remote these communities are, it's really difficult to be able to mitigate the situation that they are in.
Yeah, 100%. I mean, I can also imagine what it feels like to be like, it's not like you're being told that it's contaminated water or that it's unsafe. You'll just find out potentially through exposure. Completely separate story, but just trying to explain the scale of things. Like a few days ago, before the snowstorm that we were in just hit, I got a sign on our front door saying that our water might be shut off for a couple of hours because of some emergency and some repair that needs to be done. And I'll be honest, I don't think we even really used any in the time that it was shut off. Nobody in the house like realized it was, and we saw the sign much later in the day. And just seeing the sign, my parents panicked for a second that like, oh, is it still shut off? Is it not? Or what happened? Now, I can't imagine being in the situation where you are in a slightly more isolated area. You don't have regular, like you said, a municipal supply or a connection to stable water foundations. And then to have such a catastrophic event where the water that you would use for, I mean, very simple things like bathing and all, but like the water that you drink especially is then contaminated. This is why the community was declared a state of emergency. And then that's obviously why an evacuation plans were put in place, prioritizing elders, children, and especially medically vulnerable residents, because you have to treat it. And I can't imagine also maybe the mental health aspect of it all and the stress it could put on those individuals.
That's true. No, I fully agree. The aspect of just thinking about, I find when it comes to water, it's one of the things that, especially when you live in municipal areas, it's something that you tend to take for granted. It's you open your tap, you always have access to water, you have access to drinking water. It's always there, you never think about it. But when you are put in a crisis like this, like the ones that these individuals are facing or going through, that's when it really hits for you, and you realize, okay, this is not something that you can easily take for granted, and at any instance you can lose it. And when you mention about the evacuation aspect, Ali, I found it was it's nothing but a difficult situation, because essentially there were just hundreds of people being flown out of their home because there's just no other way but to relocate them to other areas so that they can regain access to the basic resources like water. So it's unless I find you yourself experience that personally, you'll never really understand the value of the resources that you have, as well as the difficulties that those individuals can face.
Absolutely. I couldn't agree more. Like, it's a situation that no one ever wants to be in their life. Majority of people, especially in the Western world, in developed countries, may never experience what that feels like, and that's a very good thing. Before anyone says that, or before anyone's real thinks that I'm saying it as a bad thing, it's a very blessed, privileged thing to not have to experience, and I think it's just something to be very grateful for. But unfortunately, what that means is maybe you don't have the best understanding of what other people in the world might be going through, and that can also cause a lot of issues in terms of like trying to create an equitable environment for everybody. But that's slightly a separate topic that we could touch into if we want to later. I don't know, I'll leave that up to you as well if you want to talk about the disparities of, whether or not experiencing this and how that affects the ability to change a nation, stuff like that. It's very, very separate, like global level scale of a conversation that we could go into. But I think we should also talk about what, and I'm sorry, I'm going to butcher this, but I'll say it very slowly. Cryptosporidium, means in public health. Rini, I'll let you start.
Yeah, for sure. So one of the most alarming aspects of this situation was the confirmed cases of, as Ali mentioned, cryptosporidium. So the thing that we need to keep in mind about this is that it's not just about, or it was not just a boil water advisory issue. It was an actual parasite that spread through contaminated water, and in turn, as a consequence, led to severe gastrointestinal illnesses in the Kashechewan First Nation. And it was reported that 19 individuals had tested positive for this illness, unfortunately.
That's that's intense. That's scary. Especially when you have such a small knit community. 19 individuals. I think it mentioned that 1,700 residents were evacuated. So exactly. 19 individuals from a community or where there's 1,700 people. That might not sound like a lot, but it is when you're thinking about parasitic infections or viruses. These type of diseases or conditions, those can spread really easily, and Cryptosporidium is notoriously hard to deal with. I'm getting better at saying it though. So it's resistant to a little about the parasite is that it's resistant to chlorine. So what you usually put in like your swimming pool to make it safe to swim in, that wouldn't work. Especially if you're drinking, you can't put that much chlorine because then it might be like poisonous. Which means that in this case, the parasite in basic water treatments fail to have a real consequence to it, and then so you can't really get rid of it. And I don't know, Rini, if you want to talk about like how that affects different members of the population.
Yeah, for sure. So just adding on to that point as well, given that the parasite itself, it is resistant to the basic treatment, it not only will it affect everyone, but the fact that the individuals who may have compromised immune systems, as well as children or the elderly, those age groups, they may be affected at a disproportionate level because of their health conditions and their compromised immune system. So as a result of affecting all these people, essentially the individuals who were evacuated, we would see that these individuals would be prioritized to ensure that at least they are not experiencing a lot of damage to their health.
Yeah, and so this is why when initially at the start of the episode or start of the recording, we talked about this being a public health crisis. We weren't exaggerating. We're not trying to. If anything, we might even be downplaying it a bit, but the point is that this is about a preventable illness tied directly to what is essentially infrastructure failure. And what that comes down to is more than just maybe one community or one area of Canada, but can also be a stepping stone to looking at like a national wide sort of eye-opener of, okay, these are areas of Canada that need more help or should be more developed or maybe more, I'm trying to figure out the right word, but like it's sort of more looked after for these type of issues and what that means in the future of how, governance, etc. in Canada. So there's again, while this is once maybe potentially isolated situation that we're looking into, it has applications to beyond just this community and beyond just this one area, and means a lot more than that, which is why I'm actually going to take a step and we're going to talk more about this situation as well. We've mentioned how the residents were evacuated, but it's when you talk about evacuation, a lot of times people see that as a solution, which I don't think is maybe the best word, but let me know, Renita, what you think. But like, do you think being evacuated is like a neutral thing, or is it like good or bad, or I don't know?
Yeah, no, I fully agree with you. It's definitely not from my perspective, I don't see it as a solution. It's definitely not it's not something that should be seen as a neutral or okay, yep, let's evacuate. It's not a cakewalk whatsoever. In fact, it's a very deeply disruptive process where they're physically separated from their land, their community, their daily routines, their cultural connections, and the supports they have from their communities. And essentially, what happened with the Kashechewan First Nation individuals they were relocated to hotels in Niagara Falls, where the Niagara Falls city. They took them in, where they were relocated to hotels, and by staying there for weeks, maybe even months, it just disrupts their stability that they have had when back in their homeland. And so when being relocated, and given the fact that you are simultaneously trying to manage with the illnesses, taking care of your children as well as the elderly, it's a very tumultuous process where it's nothing but stressful, and it's a matter of trying to make the best in the situation when resources are extremely scarce.
Yeah, I agree with you. I mean, I think evacuation it's what's the right word? It's like you're trying to sort of just like do a quick fix, or like I'm forgetting the word, but it's like when a disaster happens, you're just trying to figure out and try to panic in like situation and fix whatever you can in the moment. But the fact is, sort of what we hear often is like, it's not a preventative thing, it's a treatment, right? It's trying to fix something that's happened after the fact in the hopes that it doesn't get worse, but you're not looking at maybe the cause of the issue. And that's where a lot of the problems come, is that they're not being prevented, they're trying to be maybe treated, or they're trying to be managed. Oh, that's a better word. It's a managing solution of what is currently potentially a disastrous effect. And yeah, what you talked about of being in that situation where you are managing illness, childcare in a place that's not your home, and we mentioned this earlier, where it's an emotional toll. The mental stress of it. You are not safe in a place that you don't feel safe in a place that is not your own, is not your home. I mean, I very gratefully again have never had to be evacuated from an area. Actually, that's not entirely true. I haven't ever had to be evacuated from my home, but I had to be evacuated from a different place. Okay, side story. It's very brief. Growing up in Pakistan, there's a lot of safety and like issues in the nation. But there were times when we were sent home from like school because of there was like a actual safety threat of like being in that area, and it was better if you were home. So in that case, slightly have known what it felt like to be evacuated. But I was lucky in the sense that I was coming back to my home. I was not being evacuated from it. I wasn't being taken from a place where potentially kids grew up. It's the only place they've known, the place that's most comfortable to them, and then are being put in a strange area. Granted, Niagara is a very beautiful place, but it's culturally very different. And again, I don't know a lot about the Kashechewan community's culture, but with the sort of touristy nature of Niagara, or around the town in Niagara Falls, etc., I can't imagine that would be an easy thing to accommodate, or an easy thing to kind of switch into from your own background. So
yeah,
becomes a issue. And this is aside from everything else. Imagine then after going back to your own community, after all the issues and everything have been fixed, and let's say all the water issues, the contamination is gone, it won't be easy to trust the drinking water again. I don't know if you have any thoughts about that, but like I feel like there's just definitely going to constantly be a doubt or concern, especially for like a parent for their child. That I feel like goes without saying, that there'll always be a slight concern that this could still be contaminated. Yeah.
No, for sure. Like I agree. And given that, even though maybe, again, this was just one article that we came across, but maybe in the past, maybe the Kashechewan First Nations have experienced the same or similar issues where they have had to face contaminated water. But I fully agree, given that I find the trust aspect, I think it would get amplified given the fact that in addition to the Kashechewan First Nation, many First Nations communities in Canada, in fact, they're currently living under a water boil advisory where they do not really fully have access to the level of clean water that we have access to. So given that these communities, they have been living through this harsh reality for a prolonged period of time, even when someone comes in and says, oh yes, it's fixed now, the water plant is fixed now, it's safe to use, there definitely will be a trust issue. And I fully agree, because of that prolonged amount of time where they have been turned down, they've not been looked at. And it's, I guess that it's with time, like I guess time will tell. Like number one, is the water actually sanitary? And number two, is that trust element, is that trust being bridged between the Indigenous community and the government, essentially?
Yeah.
So
yeah,
I guess it's it's a very multifaceted aspect to think about. So it's nothing but difficult for the Indigenous individuals.
Absolutely. No, like I cannot agree with you more that it's beyond what, there's a long-lasting effect to these things. Right? It becomes a pattern, right? And I think you mentioned it, or you did talk about it, that many First Nation communities, the Kashechewan community, also have faced multiple water crises over the years and in the past. So that's not a new thing for them necessarily.
Exactly.
And it becomes that uncomfortable truth of the pattern. And you kind of talked about it already, but when you're talking about it as a federal point, and that like in a country that has universal healthcare and sort of prides itself on that. Like I know a lot of people, including myself, that we kind of see the fact about Canada having universal healthcare as one of the reasons why it's potentially a better place to live in than, for example, the US, right? Just as a small comparison, that is something that I've said myself, and I've seen a lot of people say it. I've heard a lot of people say it. I've heard it many times over. But you have universal healthcare, you talk about public infrastructure, yet these communities lack safe water. So as you mentioned, it becomes more of a federal thing, about more than just what is maybe happening in this community, in this area, but about what this means politically. And you've kind of already talked about it, so I'll let you start more about maybe how the political will, funding, priorities, etc., accountability, I think the best word, might, I don't know, be a discussion to have on this topic.
Yeah, no, for sure. So a way that I'm thinking about currently is the water on the reserves in which Indigenous individuals live in. It is a federal responsibility.
Yeah.
Like there's nothing beyond that. And I find it's, there are all these conversations, there are so many conversations going on where committees formed by Indigenous individuals, they are going up to the government, they're simply pleading them, letting them know about their concerns and their problems. And on the other side, the federal government, they are stating the potential next steps that they can pursue. However, there is clearly a gap. There's still a gap where the Indigenous communities, when it comes to the use of safe and clean water, they still don't have access to that. So I think it's, the work is far from being done. Rather than just having these conversations, I think it's time that we take action. Maybe if us as students, or if our no worries, if our current generation can basically, what we need to do is we actually need to take some tangible action and steps, rather, because I find these conversations are not really getting anywhere. And so it's time we translate those conversations into tangible steps that we can take to ensure that we're helping to bridge that gap, and ensuring that, for example, when it comes to access to clean water, the Indigenous communities, they are indeed getting access to that, and not having to resort to these alternative plans of last-minute evacuation means, and displacing these communities from their homes. So it's I guess it's a stepwise process where it's time to take that action, but we need to walk the talk. It's not just about talking the talk. We need to be able to walk the talk as well. And so the steps, hopefully we can find those steps so that we can ensure that the Indigenous communities, their voices are heard and their needs are seen.
Absolutely. And I love the way you phrased it. I think that's actually so true. And especially your points about, like, it becomes about looking at future generations. How do we get this into their mindset that this is a concern and that is sort of something that needs to be addressed? So it also becomes sort of an educational aspect of it, where if people going into, let's say, health policy, going into government, etc., they need to have more of an education on the Indigenous culture, the Indigenous environment, that the living situations, the infrastructure, all of these factors. And there needs to be a balanced relationship between both aspects, right? Canada's federal or government, etc., needs to have, I think, potentially a more respectful relationship with these Indigenous communities, and maybe hear their concerns more, because as you mentioned, it's reconciliation that is we've seen happen almost symbolically, but again, it's not operational, right? It requires, as you said, steps of like laying down treatment plans, maintenance, maybe the budgets, long-term planning that each takes a step beyond to slowly fix these, like stop these issues from recurring. And I think we're actually at a good point now, so we might start wrapping up soon. Any last thoughts before we want to go into the wrap up, whether it's the global scale of it, the individual community scale, anything else you want to address or talk about?
I think just one aspect that came to my mind I wanted to mention earlier on, but the aspect of when these Indigenous the Kashechewan First Nation was relocated to hotels in Niagara Falls, there was how welcoming the city was of these communities. That I found it really touched me, because it was mentioned in the article that when these individuals, they're displaced and when they need to evacuate, they experience cultural shock, given that they live in remote communities, and when they are suddenly shifted to an area that's completely different to what they're used to, not only are they away from home, but they need to try to adjust to this entirely new environment. But given this specific evacuation, there were specific community groups, Indigenous community groups in Niagara Falls, that reached out to the families who were relocated and provided them with spaces for those families to go in and cook their traditional meals, given that it's not possible to do so in the hotel spaces, as well as getting traditional medicine to these families, which they use at their homes and in their communities. So the fact that there were community members willing to just lend a hand and say, hey, we're here, and I guess reduce that sense of cultural shock and ensure that even though they are displaced, these individuals, they are seen as a person. Their cultural values are kept at the forefront, and there were people ready to just do whatever it takes to ensure that, you know, they feel comfortable, and that they don't, I guess, they're not exactly missing their home as much as they would if they just had to be isolated in a hotel.
Absolutely. I think that honestly, yeah, that was a great point to sort of bring up, because I did see that as well. And it's hard, but it's heartwarming as well. But it's hard to necessarily adjust yourself to a new culture and population that is coming in at a time of distress. And it's very nice to see that the residents of Niagara were open to that and helpful for that extent, because that's what we need more, right? More compassionate people, more people like that in the world, and to help create a better space.
Exactly. I agree. So I guess with that, we'll conclude our episode for today. We will keep following the story, and more importantly, continue to ask why safe water is still treated like a privilege rather than a right. So again, thanks for listening and tuning in to our podcast, and we look forward to sharing more stories with you very soon.
Yes, thank you all. This podcast will be available on YouTube, Spotify, Apple Podcasts, and then we'll maybe post clips. Please like, comment, subscribe, all of those wonderful things. And we hope you enjoyed. Thank you also, Renita, for joining me today. I think it was quite fun having someone other than Omar to talk to.
Thanks for having me. It was really fun.
All right, thank you, everyone, and bye-bye.